Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Alana Gurvich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. Just a reminder, this podcast is for educational and entertainment purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your healthcare plan. Join us and let's jump into the next episode.
Hi, everybody. Okay, we are back with another episode of our Neural Therapy podcast, and we are really excited to be interviewing Dr. Laura Bonilla, who is a medical doctor from Colombia. So I'm just going to take a couple seconds and tell everybody who you are. So you received your medical doctorate degree from the Universidad Nacional de Colombia, and you have been a researcher since 2007. And you also have a master's degree in alternative medicine, specifically in the area of neural therapy from the same university. Your focus of your thesis was on Charles Peirce, who is a mathematician and a metaphysical philosopher. And I am excited to learn about who this person was, because I've never heard of this person before. And right now you are you're a professor and coordinator of the neural therapy program in Colombia, which is the master's program at the medical university there. And you are also founded the Neural Therapy Association in Colombia, and you are also a part of research, being the director of research at the Southern Colombian Hospital System. And you are also an honorary member of the Turkish and the Austrian Associations of Neural Therapy, and also a member of the Ethics and Scientific Commission of the International Federation of Medical Associations of Neural Therapy. And so we are so excited to talk to you today, Dr. Bonilla. So let's go ahead and start with, can you tell us, we really just want to know who you are and like how you got interested in neural therapy. Can you tell us a little bit about why you decided to become a doctor and how you kind of went on the path of going further in your studies to learn neural therapy?
Well, thank you. First of all, I would like to say thank you for this kind of this is a podcast, no? And I feel very, very happy to be here with you. I think this is a good way to make that the knowledge of neural therapy could grow over the world. I would say congratulations to you too, and thank you for your invitation.
Yeah.
Okay. Well, how did I decide to study well, specifically neural therapy? When I was studying medicine at the National University of Colombia, I also have an interest, a big interest in physics and mathematics too. So I am in a parallel time while I was studying medicine. I also entered to the other faculties, and I usually to take other classes about this topic, and you can see what what is the relation with neural therapy. Well, I will tell you after what is the relations with neural therapy. And the thing is, after I finished my studies in medicine, I met Dr. Payan. Maybe you remember Dr. Payan. Dr. Payan is for us is the father of neural therapy here in Colombia. Despite he didn't brings the neural therapy to Colombia, but he was the leader, and he wanted that the neural therapy could grow, and he intended to put the neural therapy knowledge together with other knowledge that came from, for example, complexity science, from traditional ancestrality, from indigenous knowledge, from physiology, synthetic physiology from Russia, for example. It is very, very, very interesting, that topic. And when I met Dr. Payan, he was giving a lecture, and he was talking about Roger Penrose, and about the consciousness, and the quantum mechanics, and the brain, quantum mechanics, and consciousness. And I say, wow, this is the best way. I fall in love, so yeah, it's very, very, very happy to meet Dr. Payan, because that's why I was searching for. I was searching for a space where I can have a medicine, a medical practice, but that could be mixed with knowledge from physics and other things. That this knowledge, I didn't want that those knowledge could be separated. And the idea to find all this knowledge together was very nice for me. Yeah.
How did you meet Dr. Payan? How did you meet him?
I met him in a conference that he was given in a pediatric hospital. Dr. Eduardo Beltran, who was the founder of the creator of the master program, invited him to give a lecture in the hospital, the pediatrics hospital, and I met him there. And after that, Dr. Payan invited me to attend to a congress. Was in 2003, and I was very, very, very happy there. And I asked to Dr. Payan, please, I would like to learn. I would like to be in your office. Could you let me to attend to your office? And he said, no, Laura, I really am very tired. I thought to a lot of doctors, and I felt very tired. No, I'm sorry, but I can't. And all time I was, every time that I met Dr. Payan, I say the same. Dr. Payan, please, could you let me? Please. And finally, he said to me, Laura, you're very boring. Okay. Please, no more, Laura. And finally, I went to his office, and I learned neural therapy with him. I was there in Popayan City. He lived in Popayan City, and I stayed in that city for 6 months, learning neural therapy with him. In the same time, I worked in a medical center that was created by the community, but was propitiated. No. The was very Payan was a promoter of the foundation of that medical center, but it was created by the community. And in this medical center, neural therapy was practiced. The patients went to that center, and there were a lot of doctors who practiced neural therapy there, and so that's what I made in for that time. So I was learning with Dr. Payan, and at the same time I went to that medical center. which name was New Hope, like New Hope, La Nueva Esperanza, New Hope. It's, I think it's the first medical center. We are talking that this medical center was founded by the 80s. So I think it's the first medical center in the Americas in which we could find that neural therapy was offering to the community. So that's
I wonder if you treated some of my patients. I've had patients that came, went to Colombia. Like Colombia has been known for a long time as doing like, ozone and neural therapy. And a lot of my patients would go down there because they found out about, oh, they could get treatments there that they could not find in the United States. So
yes, Colombia is a place where alternative medicine and other therapies are allowed in our country. So there is no, well, there is a there are laws, no, but these laws are very inclusive with alternative medicine. So that's why the medical doctors here in Colombia, a lot. It's a bunch of medical doctors.
What year was that? What year were you studying with Pion? And how long had you been in practice at that point?
Could you repeat it, please?
What was the year you lived and studied with Pion? And how long had you been practicing medicine when you went to study with him?
Okay. I was with Dr. Pion in 2005.
Oh.
And I'm starting practicing neural therapy in the same year because you know that I went to medical center. And after that, in Colombia, there is a law in which when you finish your medical studies, you must to do social a social service so that you can after that you can get the permission to practice medicine in Colombia. So I after I went to Popayán in a place close to Popayán. I found a hospital in which I made my social service, and the director of that hospital was a patient of neural therapy. So he was very happy, and he let me to practice neural therapy in that hospital.
And when did you finish your medical training before you started practicing as a neural therapist?
2000. I'm lying. No, I finished my medical training at 2004, and in this year I went to Popayán. So I finished in the mid of the year medicine, and in the second semester of 2004 I went to Popayán. Yeah, and my social service, I made my social service in 2005.
So the whole time you've been a doctor, you've been a neural therapist. They're like this for you.
Uh-huh.
Amazing.
Yeah. After I studied with Dr. Payan, I take my needles with me.
Yeah.
And all time, I was practicing neurotherapy from that time. And in National University also in the in the training in the when you are studying medicine in my university there is a way in which you can learn alternative medicine like a subject. It's a subject, an optative subject, so you can learn, but all all the types of alternative medicine. So you can study homeopathy, acupuncture, osteopathy, neural therapy, and something like that. And for that time, when is what year was maybe 2002. I took a deepening line in alternative medicine with Dr. Beltran. This lasted 2 years, deepening in alternative medicine. So from that time, I know about neurotherapy, but also about other therapies. And finally, when I finished my medical training, I decided to practice only neurotherapy for a certain time. That is an aspect that maybe some people say it's crazy to only practice neural therapy. People usually ask me, Laura, you don't practice other therapy, ozone therapy, you don't practice acupuncture. I usually said no, I only do neurotherapy. No, it's not possible. Yeah, it's possible. Yeah, and after the time was advanced, was passing, I integrated to my practice other therapies, but not too much. Maybe two, no more. Yeah.
So just hearing that how medicine is in Colombia just makes me so jealous. If we had that here in the States, it would be so wonderful for patients, Like the fact that everything is so separated is it's difficult for people because they have to kind of see two different doctors to do things, So can you tell us a little bit about, I know I was at the conference there was the neural therapy conference that we had in Florida, and I remember seeing you present about some of the research you were doing on the sphenopalatine ganglion and finding a different way to do it. Can you talk a little bit about the research that you've done since you've gotten out?
Well, those research could be possible with the help of my university. In the Faculty of Medicine, we have the support of a morphology department, and we have access to the dissection theater within the Faculty of Medicine, and we practice or we usually are making some researches about new techniques or new ways to access to some nerves and plexus or ganglions. So it's very, very, very nice to have the support of the morphology department. And that's why that was the way in which I could make my research. I was asking for new ways to reach, for example, a gastric ganglion and to reach to vagus nerve. And before pandemic, I started the research in the dissection theater. Of course, pandemic, so I could to start again the research maybe 2 years ago, and finally we organized all the evidence and to the pictures and so on. Those researchers, I will publish these researches in my new book. It's my book on of neural therapy that I will publish. I hope this year will be delivering the book for the month of June or July, maybe. And well, the way in which you can reach the ganglion, for example, Gasserian ganglion, usually if you review all the techniques from anesthesia or from neurotherapy, all the techniques always seeks to reach the same point, which is the oval fissure. I really don't know what is the exactly name in English. To the oval, in español se dice agujero oval, oval, and I was asking, I wondering if we could reach to Gasserian ganglion by the pterygopalatine fossa. But when you review again all the techniques to enter to the pterygopalatine fossa, usually are techniques that have some disadvantage, because for example the extraoral approaches up for above the zygomatic process. In this way, you can reach a lot of arteries, and there is the maxillary sinus, so you can reach a lot of vessels. And the other way in which you can enter to the fossa is by the palatine degrader, palatine fissure. And if you enter to this structure, of course you will be exactly in the pterygopalatine fossa. But also I found in a lot of patients, I don't know if you had the same experience, but in a lot of patients had hematoma on the palate. And in other cases, just I couldn't enter into the hole, into the so there are anatomical variations in the patient, so it's not a sure, very exactly or efficient technique. So I decided to try other way to approach the pterygopalatine fossa by the end of the palatine bone. By the end, is very, very. If you take as a reference the third molar, it's posterior to the third molar, maybe 2 millimeters, and you can enter in the fossa, because there is here is the final of the palatine bone, and you can make a angle to the needle, 45 grades, and you can enter directly to the fossa. And after that, we made the research in corpses, in the dissection theory, and we inject methylene blue, and after that we could observe in the cadaver, we could observe that the Gasserian ganglion effectively painted in color blue, and the reason is that there is a communication between the pterygopalatine fossa with the fossa, the Meckel fossa, in which is the Gasserian ganglion, by the but by other structure, in which is the maxillary branch of Gasserian ganglion. So this is a way to reach very easy, because the technique is very easy. It's like it's like you are injecting into the a tooth, no. So it's very easy to practice. And the other technique was to make a different way to approach vagus nerve, because under the by the this is the retrostyloid space. You can find a lot of structures, facial nerve, glossopharyngeal, the spinal nerve. So there are a lot of structures, are the superior ganglion, cervical ganglion. So it was very, very interesting to find a way in which you can reach the vagus nerve. by the transpharyngeal, for example. Transpharyngeal is like you are making, you usually make tonsils. You inject the tonsils very frequent, and the only thing that change is the dip. So you make a wheel in the tonsils, and you go deep 2 centimeters by this transpharyngeal approach, and you can you could reach the places that is very near to the carotidial sheath. You can reach this place, and the this carotidial sheath in the test that we made in the dissection theater was of course positive. Methylene blue was uh, painting all the carotidial sheath, and after that we found that vagus nerve also was painted in color blue. So it's a very, very easy technique. It's like you do when you make the injection in the tonsils, is like a tonsils technique, but you can go 2 centimeters deeper.
Yeah, I figured that out by accident one time.
Yeah.
For those of you listening, on the NAANT website, they do have your talk about the trying to do the sphenopalatine ganglion from the back of the mouth, which was really an interesting talk. So that should be on their website if anybody wants to know more. But I think it's great to do all these studies and figure out like safer ways and easier techniques for practitioners to do some of these ganglion.
Yeah.
Can you tell us a little bit about the book that you're writing, or that you're done writing and publishing? What is it?
Okay. No. Well, suppose that I finished the book.
Yay.
Yesterday. Yeah. Last night.
You finished the book last night.
Yeah.
Wow,
I think
congratulations.
So.
That's a huge thing.
I think so. Well, it's a project that I was planning from the Congress, the past Congress in Colombia, 2022. It was a project at that moment, and I began to work on this project. I made the proposal to Springer Nature Publishing Group to publish this book with them, and in by December of 2023, I received the confirmation from them. Yeah, you could publish with us. And finally, 2024 was all time working on the book. The title of the book will be Neurotherapeutic Medicine, an exploration from complexity science for neurotherapy.
And right now, it will only be released in Spanish.
No.
Or in English?
English.
Really?
Will be released in English language.
Oh, that's amazing.
Yeah.
That's great.
Yeah.
Wow.
Yeah, and it's not like other books. The other books of neurotherapy of my colleagues are very, very good. I know a lot of books from Hans, from Lawrence Fisher, from Stefan Weinschenk, from Hüseyin Nazlıkul from Turkey. And also, of course, I read the book of Robert Kidd also. But the focus of this textbook is a little bit different, because it's the intention is not to you offer to the reader the same scheme about all the techniques of neurotherapy. That is not the objective of the book, but it's a combination, is a mixture between thought and between practice. The techniques that we are including in this book almost all techniques are new researches.
Wonderful.
Of course, are not all the techniques are included. Only some techniques. Yeah, techniques under research and new proposals. For example, Hussein Nasli could have some proposals for new approaches to the spine, and very interesting. Stefan also in this book wrote a chapter about gynecology and techniques in gynecology, and so on. Yeah, and the other part of the book that I think is the most important part is about what I call thought, reflections, theory. What is the basis, the foundations, scientific and philosophical foundations? What is the epistemological view of neural therapy? For example, for research, for discover new knowledge in neural therapy, and the complexity theory is the center, the core of the reflections. So that's why I invited some authors to contribute to my book. Experts in complexity science. There is an expert in electromagnetism also, because there are some topics about for example, what is the impact of the metals in the body. You know, the implants is in the
Yes.
in the oral cavity, and what is the impact of these things in our body. So there are some experts in this book talking about that. And of course, you know, Dr. Payan was a person who develops a lot of thinking about how the basis of neural therapy and the practice of neural therapy could also could be applied to the social and social aspects and community, public health, and so on. So it's a very, how to say, you know, it's not a strength vision, it's a stretch vision, but it's a wider one. About a lot of things, from philosophy, complexity science. In complexity science, there is a chapter in which we talk about thermodynamics, quantum physics, written by experts, chaos theory, nonlinear dynamical systems, and so on, and how these concepts and theories could be applied to the medicine, of course, to the neurophysiology, and what is the link, for example, with the researches of Speransky, for example, because Speransky was a visionary, and that's why we developed in this book. These are the ideas, the central ideas of this book.
Wonderful. That sounds great. I'm excited to look at it. Do
Yeah.
you know the published date when that's going to be, or is that unknown as it
The exactly date, no. I suppose it could be on June or July. I hope.
25?
Yeah, of this year.
Oh,
Yeah.
wonderful. Okay. Will
Yeah,
you let
yeah,
us know so we can post it to our students?
yeah, of course.
Okay. Wonderful.
One of the things that came up at a different conversation that we had was your work studying Procaine IV and what you published in Procaine IV.
Yeah.
How do you use that? What do you see with Raf Oettmeier?
Yeah.
Yeah, we Ralph also we wrote that chapter too for our book, in which we are making a huge review about the history of the use of Procaine intravenously or intravenously, but also in intraarterial use of Procaine. More than 100 years of using Procaine intravenously, for example. A lot of researches made by a lot of authors from Romania, from Germany, and a lot of places, even United States, Colombia, Argentina. This way of administration is very, very. It was very common in one time in the past. The way in which in this moment, the way in which I applied this this Procaine, IV Procaine, is the same way in which my friend Ralph applied in Switzerland. Ralph have been practicing this kind of administration a lot of years ago. I don't know how many years. I don't know, maybe 10 years. I don't know, but he had a lot of cases of IV administration of Procaine. I suppose 7,000 maybe applications. I really don't know. So he used a protocol for applying this kind of administration, and this is the same method that I used in my clinic, in my center.
And you are taking Procaine, sodium chloride, and bicarbonate, or no bicarbonate?
Bicarbonate plus bicarbonate, both.
And what are you seeing? Can you give us a patient case?
Well, the experience with bicarbonate is, the explanation about how it works is because that Procaine had some pH, that when you apply it to the body, it changes the chemical structure, and for a form that it's that it can become an ion, or the exactly word is
Lipophilic?
One part is lipophilic and other part is hydrophilic. So the mixture with bicarbonate change that configuration and allows or let the Procaine to enter into the cell and act more time in the cell. So that is the way in which it works, and what the effects that you can see in the patient a lot. You can apply this method in acute cases, for example, in autoimmune diseases, in diseases of nervous system, for rehabilitation, of course, cases of acute, for example, infection. I don't know. Of course, this could be a little. The people could questioning this method because for the acute cases, maybe you must be within the hospital in a hospitalary context, but of course you can use in your office with a lot of you must take care of the situation of the patient, and all time you must to evaluate or assess if the patient needs to go to a hospital or emergency department. But you can use, in some cases you can use it with the other therapy as a complementary therapy with other ones. And for the chronic cases, you can use it in almost all. But this has an indication for me is my opinion, that when you reach this stage of and you decided to make an intravenous application of Procaine, you must first you must first to apply neural therapy, segmental therapy, interference field therapy, first. And after that, maybe you can use the intravenous Procaine as a complementary treatment. This is my opinion. Maybe I suppose maybe Ralph could say, Laura, it is not my opinion. It's my opinion. It's my opinion. You should do first neural therapy, a good neural therapy first, and after that you can make this treatment as a complementary one.
How often are you using it? How often do you use it with patients? Is it a one time, or is it a weekly or monthly?
Okay. I use it really not too frequent. Maybe it could be once a monthly, once a month. Yeah, because not all patients are in the state in which are prepared, is the word, exactly word, are prepared. For me, that the patient is prepared when you have already treated all the focus on this body. So dental focus, dental focus, and something like that. So it's not easy. The way in which we make neural therapy, maybe it's a little bit different, but the reason is because we integrate the knowledge that came from synthetic physiology from Russia, for example, and it makes that something in our minds change it, and that's why we made neural therapy a little bit different based on this physiology. It's very interesting. I wrote a chapter also in the book about synthetic physiology and a lot of things and history about the Russian people. It was very, very interesting. And also I talk about the British nervism, that is a new concept that I have introduced, because it's not common to listen to or to hear about the British nervism. Is a new concept, and because there are other proposals that Henry Head and James Mackenzie made also from Great Britain.
You had mentioned that nervism. What can you explain what that is exactly?
Okay, nervism is a stream or a school of thought that originated from Russia exactly, but also Russia and England specifically from the 19th century. For I will tell you so simply. There are two streams or approach of the physiology, and the way I view two approach or two perspectives of the physiology. The way in which we studied or learned in Occidental, in West world. This is this way I named as analytic approach of physiology. You must in this approach you must separate the organs, separate the systems in separated things, and you have no a unity of the organism
Right.
body-mind unity. And this is not the way in which the synthetic physiology takes. Synthetic physiology, so the characteristic things, that the core is that they found that nervous system was the coordinator of all the physiology of the organism, in all the, not only for the physiology but the pathological processes in the body. And of course, very early, they discovered, for example, the influence of the nervous system on inflammatory disorder. Very early, I'm talking that maybe for the end of 19th century, they were discovering that the nervous system had an influence in these processes. So they began to develop some methods to diagnostic, but also to treat all disorders. And for example, Wisniewski, they were surgeons of Soviet Union, and they developed some methods from the surgery to make a therapeutic anesthesia, no, like a therapeutic anesthesia. They called novocaine blockage, but in the mind, in their minds, they had the idea that this therapeutic anesthesia had properties that make a regulation on the nervous system, and so they treat a very difficult condition as necrosis, such as necrosis, burns, sepsis, shock. So very for our time, they were conditions that maybe only you could manage in the intensive unit care, no. But for that date, they treated these conditions with anesthesia, with Procaine specifically. There are a lot of information about the methods that they used, and we integrate all this knowledge that came from the Russian physiologists and from the medical doctors, from surgeons as Wisniewski. And this use of Procaine is not they began to use the Procaine in the beginning of 20th century. Huneke brothers, the history said that Huneke brothers began to use the Procaine by 1925, and Wisniewski began to explore the use of Procaine from 1906. Wow. 1906, almost 20 years before Huneke could discover the use of Procaine. And they said also that they went a lot of times to Germany to give some speeches and lectures and conference to Germany. So it's very interesting to read those those stories from them. So nervism, in to give an abstract, the nervism is an approach of the medicine. It's not only a physiology approach. It's an approach in medicine in which nervous system is the center that coordinates the physiological aspects and pathological aspects. And based on this, you must understand how how the nervous system organize all the physiological manifestations and processes in the body so that you can treat the patient. Of course, the thing about nervism is not the end of nervism is not it's not until the Wieniawski or Speransky. There are more researchers after Wieniawski. After that, Speransky comes, and after that, Bikov comes, and also there are other guy whose name is Peter Anochin, who developed a new theory that he called functional system theory, functional system theory, and it's a very, very interesting theory. It's so visionary theory, which integrates the knowledge of physiology and new physiology with this perspective. So advanced physiology with cybernetics and information theory. This is very, very interesting.
Cool. Yeah, that's neat. Okay, we're going to ask you a fun question now.
Fun question. Okay.
Do you have a favorite injection that you like to do with your patients that you feel like really helps a lot of patients?
One that you pull on more than any other.
Yeah.
And it's not a fair question, we know.
Very fun question. It's very difficult. Well, more than more than an injection, I would prefer to say a technique. I would prefer to treat mental and emotional conditions.
Yeah.
I would love.
Can you explain to us how you use neural therapy to treat mental emotional conditions?
Okay. Well, the base of this technique is a functional system theory, the nervism theory, and the use of Procaine, and I mixed with other approaches of alternative approaches of psychology, like hypnosis, neuro-linguistic programming, EMDR. I made a synthetic mixture, to make a new technique with Procaine, with the vision of neural therapy. And I developed this technique with a friend of mine who is a psychiatrist from my country, and we developed this technique joining all these theories and practice. So the way in which it works is that you use all the best of all these techniques and approaches and mix with Procaine so that you can treat the trauma, the emotional trauma, so fast, very, very, it's so quickly. I will explain with an example why. While you treat emotional trauma with psychoanalysis, and you can last 1 year treating only one trauma, you can last with EMDR, for example. You can last treating one trauma, for example, in 8 sessions with the
eye movement.
Yeah, but we found that mixture this information, the mixing this information, the EMDR, neuro-linguistic programming, the use of Procaine, hypnosis, and other techniques, we found that it was by an accident. Really, it was a discovery, serendipitous discovery. And we realized that we could treat 2 or 3 traumas in only one session. It was very, very, very fast. My friend, the psychiatrist, he couldn't believe it. Laura, is not possible. Only one session, that is not possible, Laura. No, yeah. It could be. Yeah, it could be. So in the book, we made an effort to put all the information together, all the theories, which are the base of this new technique, and finally we offer to the reader some clinical cases with different diagnoses. For example, um, as suicide behavior, bulimia, bipolar, uh, bipolar disorder. Have also cases of dissociative disorder, two personalities or more in one body. Have cases so strange like tocophobia, for example, and depression and anxiety and so on. And we show how in a very short time we could see how all the symptoms of these patients just disappear, and so that the diagnostic no is not fit in this case of the patients. It's very very beautiful. I really love this approach.
Wonderful.
I think I am bored to that. That really is very you can see as the people could is a rebirthing. It sounds like a new age, but no, it really is like rebirth.
So you were at least one training that I know of. Do you have some trainings coming up that you're going to be doing with kind of working with neural therapy and more mental emotional?
Well, the next courses are for the moment in Colombia. We are preparing a course in Colombia in Spanish language. Maybe, I don't know if in Mexico will be other of these courses. I must ask first to Carolina, to Stephanie Gonzalez. Maybe other, and I don't know. Maybe on the future in the United States or Canada. Yeah. For the moment, for this year, only Colombia and possibly in Mexico.
I think that would be a great thing for Oregon, since we're using lots of psychedelic they've okayed like psychedelic mushroom therapy for use with a lot of patients here, at least in our state in the U.S. And so there's a lot of people that are starting to work with utilizing more of these medications to kind of help people reset things. So yeah,
very very useful. I love that.
Yeah.
And of course, techniques I use a lot. I use vagus nerve technique a lot, and Gasserian ganglion. Maybe those are my favorites, I think.
Okay.
See? Yeah.
Great. Where can people find you if they want to connect with you to do research or come see you in Colombia?
Well, I am the website of the Colombian Association of Neural Therapy. I have a website there, and my email, my WhatsApp number. I'm open to all the people which loves to research in neural therapy, and I'm open. Mm-hmm.
Great. Thank you so much for connecting with us today.
Also, thank you for all the work that you're doing, publishing and researching and writing books. I think you might sleep less than I do.
Yeah. Look at my eyes.
Yeah, me too. I've got good lighting.
Oh, girls. I apologize for my English.
It's great.
No. I'm studying. I'm still studying English.
I think learning another language is one thing, but learning medical language in another language es más difícil.
La lengua de la so hard.
Es muy difícil.
Thank you, Dr. Pinilla, for joining us today. We really appreciate it.
No, thank you. Thank you to you too. Bye-bye.
Thanks for joining us today. If you like the episode, please like and subscribe to our channel and review us on your podcast players. Also, if you think this episode is helpful to some of your friends or colleagues, please share it widely. If you are curious about learning about neural therapy or other injection techniques, check out our courses on learnneuraltherapy.com. We'll see you next month for our next installment of the Point of Medicine podcast.